nursing is an applied science, so you're also using your intellect all the time. You're using critical thinking skills, you're using the science that you've learned, and you're applying it to this particular situation in front of you.
Hi, I'm Mirav, a curious journalist with a passion to know what people do for a living and how much they make. So I set out to find out. Today we have another episode about the miracle of birth. And by the way, if you haven't already, please check out my previous conversations with a midwife and a doula, published on March 4th and 11th. Lots of great info there. Today's guest is Jessica Wilson, a nurse with years of experience both in the delivery room and emergency room. So let's find out what it's really like to be a nurse. So Jessica, first of all, thanks a lot for doing it.
Oh, you're welcome. It's a pleasure.
Start by telling me what made you become a nurse to begin with.
So what actually inspired me was seeing my mother deliver her son. I was 7 years old.
Wow.
And she had a home birth. And I just remember seeing that process and just being in awe. And, being able to see in the comfort of our own home my little brother being born. And
weren't you in shock at 7 years old?
No, because somehow my mom made it was a natural process. So before she even delivered, of course I was seeing her as her belly grew. Also, she showed me pictures of births. It was more artistic pictures. She had said that she wanted to prepare me just in case, for some reason, I was the only one there when she gave birth. So anyway, I had a chance to see that delivery, and it just brought so much wonder early in my life. So then I thought, well, maybe I would want to be a midwife.
At that age?
Yeah, it developed into
Okay.
that. So I thought, well, maybe I'll try through nursing, right? So as time progressed, I ended up going to nursing school.
How many years did you have to study?
It took me 3 years. There's many different approaches to studying for nursing. I went right into an RN program through my community college.
What is RN program?
It's a registered nurse.
Okay.
And you have to sit for boards after you've taken the courses. It used to be that hospitals had nursing programs, and then that started to get phased out, and colleges started taking over nursing programs.
Okay.
So this community college offered a program. It was local. It was very easy for me to get there. So I decided to do the associate's degree RN program. There are also bachelor degree programs that one can do. The advantage for me was that I was able to get it done quickly and then get right into the hands-on nursing.
And you started as a regular nurse?
As a registered nurse, yep. I started after I completed my exam.
In a hospital?
In a hospital, yep. So I went for an interview. I actually went to a hospital that was run by nuns. And so I actually had to have an interview with one of the nuns, and I applied for 3 different positions. One was maternity, the other was a cardiac floor that specialized in cardiac, and then the other was medical surgical. And in that time, it was very common for people to have to go through medical surgical nursing first to kind of get your feet wet and get accustomed to nursing. It gave you a broad spectrum of different kinds of nursing. You got a lot of experience. Back in the day, that was the approach. You go to med-surg first, and then you go to your specialty.
Okay. And now, from what I understand, you practice as an ICU nurse and a delivery nurse.
Correct.
There's no contradiction between the two or scheduling problem?
Well, thankfully, the hospitals where I have worked, they have been willing to share me. So I would work 1 day a week on maternity and 2 days a week in the ICU.
Which is your favorite?
I love them both.
Really?
I can't figure out exactly which one I prefer more. So yeah. So I have done that for a number of years. Most recently, though, I am working full time on maternity, and on occasion they will float me into the ICU.
But in ICU, you run into a lot of problems. People may be dying.
Yes.
But delivery is like a whole new world, right?
Right. Yeah, so I get the beauty of both.
What is your function in the delivery room, let's say, as a nurse? What do you have to do?
I admit a patient. I assess them. I check that the patient is doing well, and I also evaluate how the baby is doing. So there's different ways that we monitor babies and make sure that their fetal heart is stable. Labor and delivery is a fluid process and can be unpredictable sometimes as far as how women respond to labor. And you may not know when a woman comes in, she may think that she's going to have her baby imminently, and so you're moving quickly, or she may not be having her baby imminently, and you have some time. So it really kind of depends on the woman when she comes to the birth center and how things are going that way. So, but we settle them into the room, we orient them to that space, we place them on a monitor so we can make sure that the baby is doing well. We listen to the fetal heart tones, we look for movement, make sure that the baby looks healthy, and we want to make sure mom is tolerating labor as well. And then once I have them settled into the room, then I prepare them for the labor process. So I might help them with position changing, comfort, all of those things that will bring comfort during the labor process.
Do you work together with midwives and doulas?
Yeah.
And the doctors, obviously.
Yeah, so every birthing center is a little different in how they operate, but how ours operates is we have one OB provider on, and then midwives underneath that OB provider, and then we do have doulas, and we have the nurses.
Okay, and what do you do in the ICU as a nurse?
In those scenarios, I work as a medical surgical ICU nurse. So,
what does that mean?
So I see patients that may have like severe gastrointestinal issues that have gotten infected, or maybe someone that had a stroke, or a lot of times we have patients that have become septic, meaning it like they have an overwhelming infection. We see patients that have had respiratory problems and end up needing to be put on a ventilator. So I've seen a variety of different kinds of patients. I get to see a little bit of everything because I'm in a smaller hospital. Patients that become very critical and maybe we don't have all the services available at the community hospital where I work, we may transfer them out to a higher level of care.
I want to talk about the money because the show is called How Much Can I Make?
Oh, okay. Yeah.
So how much can a beginning nurse make in ICU? Is it the same pay, by the way, for ICU or for delivery?
Really, it depends on where you work in the country and where you work in New York. So the farther north you go, the less pay you get. The farther south you are and the closer you are to the city, the more pay you get. Also, if you decide to become a traveling nurse where you are not working for a hospital, you do get paid more for that. Some people will take on a traveling position and they can get paid up to $90 an hour. Plus, they will have their insurance covered and they get paid for housing because they may be traveling to a different part of the country.
And how much a regular nurse in a hospital can
So I make about $59 an hour.
Nice.
Yeah. People farther north, like in the Albany area, they only make about, at the most, $30 an hour. So
wow, that's a big difference.
Yeah, there's a lot of variability. And it also depends on your degree. So an LPN, who's a licensed practical nurse and has only about 18 months of training, will get paid less, whereas an RN, they'll get paid more. If you continue with your schooling and you get a master's degree and become a nurse practitioner or a nurse educator, you can get paid more.
Like how much more do you think?
I know that like nurse practitioners, they can make up to, between $60 to $90 an hour, depending on where they are.
And they get all the health insurance and all the benefits, right?
Yeah, depending on what group they work with. For example, a nurse practitioner who works with a physician out of an office, she might get paid something a little less. Right now, nurse anesthetists, they're the ones that work with anesthesiologists. tend to get paid the most.
Really?
Yeah, they get paid very, very well. So I actually, when I was in ICU, I had nurses who had graduated from their program, went directly into ICU because they needed ICU experience, and then were preparing to take courses that led to nurse anesthetist program.
Why did she need ICU experience?
A lot of the medications that are used in the ICU setting may also need to be used in anesthesia.
Oh, interesting.
And you need to be aware of the physiology. There's a lot of science behind making sure that the patients are safe.
Do you have a lot of opportunities for overtime?
Oh my goodness, yes. Right now there's a nursing shortage. And so
I hear that for 20 years.
well, that's what they say. And so when I had first started, though, it was harder to get into hospitals. Nowadays, many nurses can go right into the specialty that they would like. So when you go to nursing school, you get a kind of an overview of nursing. You get a little taste of everything, and then you take an exam that goes over all of those facets of nursing. And then while you're in nursing school, you begin to see, oh, what kind of nursing do I like? Do I like psych nursing? Do I like OB? Do I like ICU? Do I like med-surg? And also don't forget elder care. That's very popular right now. And also as the baby boomer generation is coming, there will be a lot more elder care. And so there's plenty of nurses who are also involved in nursing home settings and assisted living settings, that kind of thing.
So when you get the overtime, you get time and a half or double time?
It varies depending on what they need. So overtime I can get time and a half, but if they're desperate for someone to come to the ICU and no one is available, we will pay you double time, and it's wonderful. And then also on certain holidays, depending on where you work, they will also give you time and a half. So for New Year's, I worked and I got paid time and a half.
Cool.
And then you also get a differential if you work night shift.
That's what I was going to ask you, the
Yeah.
shifts.
Yeah, so, night shift in general is not the most popular shift, though I have to tell you, it is much more calm. You have wonderful team players. I loved working the night shift when I was working the night shift. It's just hard for the rest of your life.
Right.
But where I work, you get a $5 differential, so you get paid $5 more on
Per hour.
per hour. And then also, depending on certifications, so people can be certified in a specialty, and so you get paid more if you have certain certifications. So I'm a critical care RN. I'm certified in critical care. I have to maintain that certification and renew every 3 years, and do continuing education. But with that, I get paid a differential.
Did you ever want to do traveling nurses?
I had considered that, but I decided not to just because of my living situation.
Right.
That's the other beauty of nursing, is it really can fit into your life. Your schedule tends to be a little more flexible. You can do 8-hour shifts. You can do 12-hour shifts. So for me, I do 3 12-hour shifts a week, and then I have my 4 days off to do the things that I need to do elsewhere.
Wow.
Yeah.
That's fantastic.
It's fabulous. Those 3 days are intense. Sometimes it takes me a little bit to recover. But yeah.
What is the most challenging part in the ICU and the challenging part in OB?
I think for me personally, it's hard to see people suffer. And in both situations, I can see people suffer, right? So I see people suffering from illness and sickness and struggling with their life in the ICU setting. And I'm doing all that I can to help them get through that. And then in labor and delivery, a mama is working very hard and going through some suffering as she's trying to deliver her baby. And you're trying to give them tools to help them walk through that. In both situations, you're seeking life and hope for the individual, and you're using the tools that you have to help them.
Do you have any kind of a memorable story from either ICU or OB that really made you feel so happy?
Yeah, I mean, I have many stories because I've been doing this for years, but I do remember one in particular that was very special. There was an 18-year-old boy who had overdosed. He had broken up with his girlfriend, overdosed on drugs, and thankfully his parents found him in time and were able to bring him to the hospital. But in the overdose, he vomited and aspirated all that vomit
Ooh.
into his lungs, and he had something called ARDS, Adult Respiratory Distress Syndrome, where all that got into his lungs and there was a big infection. And he's a young boy, he's 18, and he looked like he was dying. For many, many weeks, we weren't sure how he was going to do. He ended up being on a ventilator, and we were treating that. And then over time, he did heal, and we were able to get him off the ventilator. And while he was on the ventilator, we had him sedated so he wouldn't be uncomfortable. And over time, we were able to wean him off all the different medications that he was on to help keep him alive. And we were able to get him off the ventilator, and he healed and he did well. And we just were just so pleased to see him succeed and regain strength, because we weren't sure if he was going to make it. And then fast forward about a year later, he was so grateful for the second chance that he got. He came and he worked at the hospital as an aide for a little while. He's still alive. He's still doing well.
No drugs?
No drugs. And his mom, on every now and again, I see her. She also is a nurse. Touch base with her, ask how he's doing. And that was always just a real sweet blessing to see someone be able to get through and have a victory in their life. We gave him another chance.
Totally. Second chance for sure. Mm-hmm. Do you have a story from the delivery room that you could think of?
I wouldn't want to scare anyone, but sometimes, there can be situations where babies come out and they've been stressed during labor.
Yeah.
And so you have to resuscitate them.
Did it happen?
Yeah, I've had that, where I've had to resuscitate a baby. The thing that's so beautiful is babies are very resilient. They want to live. They really want to live. And so
But is there long-lasting ramifications?
For some, yes. There can be, depending on how stressful the labor process was. Generally speaking, we have had patients that are resilient and are fine, So there are times where people can have situations where the baby struggles, and there can be long-term ramifications, and that's the part that's always hard on maternity, because there are more lawsuits more lawsuits when you're working on maternity. Not that I've had anything, but
how can they blame the hospital?
If their baby did not turn out the way they thought, and the child has any kind of cerebral palsy or anything like that, they can seek to blame the people who were part of that delivery process.
Wow.
Yeah.
That seems unfair to me. So how long does it take you to wind down? You come from this 18-year-old overdosing, you have to take care of him.
Sometimes it can take days, especially when you have a trauma that you've experienced. I've seen some very traumatic things, and I won't go into all the details, but sometimes it takes days to process, because I look deeply at the meaning of life, and I think each person is unique and special, and when people struggle, it's hard for me to see them struggle. So I struggle with them. And so sometimes it does take me a little while to process and look at the value of that person. Each person has a unique gift to give. Not only am I giving to that individual, but often they're giving to me. There's something special that they're giving to me, and they're in their process as well. The beauty is I get to journey with them. I can give you an example. The other day I was floated to the emergency room, and I was taking care of patients in the emergency room. If you are an adrenaline junkie and you really like to get some highs, work in the ER or work in trauma. It is invigorating. You get a huge high, and you are going, and you have to use your thinking skills quickly. There's no time for pausing. You just go and do, and it just, you extend yourself always. And so it took me probably 3 hours to just come down from doing a 12-hour shift, just because my brain was racing after I came home, what all the different things that I had experienced. And I had done a 12-hour shift, so it was 11 o'clock, 12 o'clock at night by the time I finally felt like I could just kind of settle my brain and rest.
Wow.
So, so there can be that. And generally speaking, whenever there's an emergency, whether it's a baby that is coding, whether it's...
Coding? What does that mean?
That means that they are in either respiratory distress or cardiac distress, and you have to resuscitate them and bring them back. You got to move fast. You follow an algorithm, you fit into this algorithm, and you take care of them, and you follow that procedure, and oftentimes it works.
Did you learn in school how to resuscitate a baby?
Mm-hmm. Yeah. I took a neonatal resuscitation class, and we have to renew that every 2 years. We keep up our skills so that we're always ready if a baby needs to be resuscitated.
Do you have any kind of a psychologist or psychiatrist for support system for the nurses?
There are programs out there for nurses who have caregiver fatigue. I haven't utilized that because I have a huge support system here with my family. My husband is a tremendous support. Nurses need to have good friends, good family to support them through the struggles. They need to be able to tell their stories. And nurses also often will find that their family doesn't understand their story. So then they get together and share their stories amongst themselves. Because we see a lot of things that can be tragic and difficult. I can tell you where I work, there's a wonderful chaplain that comes around and is available, especially after a tragic event. And they do something called Code Lavender, where after an event,
like somebody dies or something.
Someone dies,
Right.
or just the circumstances surrounding that particular patient and the care involved. So they have a social worker and a chaplain, and they take time for a debriefing, kind of talk through the situation and work through the struggle.
Now you work closely with all kinds of sickness.
Yes.
How do you protect yourself?
I think I must have a strong immune system because I've been exposed to a lot. But obviously the standard of care for all patient care is good hand washing. So we do hand washing.
Do you work with gloves all day long?
When I'm going to deal with bodily fluids, yes. But main thing that we do is hand washing. You wash your hands before you go in and take care of the patient. Anytime you touch anything in the room, you wash your hands after. That's why you'll see these little hand washing stations, or you'll see the little pumps and we're washing our hands all the time. So that's primary. They call that universal precautions. Good hand washing. And then we will wear masks if there's any concern about droplets, and depending on the disease, there's airborne precautions, droplet precautions, contact precautions. But sometimes, like in the emergency room, a patient may come in and you don't know what they have.
Right.
So many of the ER nurses and doctors, especially during the height of flu season, will just always wear a mask.
We see a lot of movies where nurses, it happened, usually it was male nurses, and in England it was a female actually, where they put poison in the IV, or they put the wrong medication in the IV. Do you check nurses' behavior?
Yeah. So there's a lot of, when nurses are hired, a lot of the directors and managers are, looking out for behaviors and history. But I have actually precepted a nurse who had a drug problem, and it was discovered over time, right? So, and her behaviors were odd, where, she'd be gone for long periods of time after having done a medication pass. I remember another nurse telling a story where one woman, she was just so addicted to narcotics that she came on her day off and just went up to
steal medication.
To steal medication, and she was just so out of it that she was caught right away. There are checks and balances. The pharmacy keeps track of all of the different narcotics and medications, and there's a certain count, and there's a way everything is locked. And we do look out, especially when you have somebody new who may have some questionable behavior. But the other thing is that nurses are under a lot of stress, and if they have addictive tendencies, we also want to help them. So there actually are groups out there to try to help nurses who may struggle with addiction and help them recover and help them get back on their feet.
Do you love your job, by the way?
I love it. I love it. Yeah, I feel like I'm able to give all of myself. I enjoy going into those patient rooms and just being with them. I feel like everything else kind of goes away, and I can just focus on that person and what their needs are, give all that I can. And that's the other reason why I love ICU nursing and OB, because I do have that opportunity. Whereas often on a medical surgical floor or in the ER, I would have to spread myself pretty thin.
Did you develop any kind of relationship with any patient that saw them or had contact with them beyond the hospital stay?
Yes.
You do?
Yes, I have. Yeah. I don't do that too often because, gosh, that would be, I've been doing this for 20 years. I can't bond with everyone. But I also do feel like, I'm on the timeline of their life for that moment, and that's a treasure, and they give to me and I give to them. But then there are some that I've bonded with and still will maintain a relationship. Certain women who have had their babies still will reach out to me and send me pictures.
That's a great compliment for you.
Yeah, it's a delight. Yeah, I have a story.
Yes.
Now that I'm remembering, that was pretty neat. A woman came in for a scheduled C-section. It was her second baby. She walked in and I was like, "You look like you're in labor." And she said, "Yeah, I think last night I went into labor." There was really no reason for her not to go into natural labor. She could have what we call a VBAC, where a vaginal delivery after a C-section. So her first baby had been a C-section, and then now here she is in labor, and she's in natural labor. And so I coordinated with the different providers, and we felt it was safe for her to go ahead and have a vaginal delivery. She did.
Wow.
And she was forever grateful for that. And she wrote up something about that, and I ended up getting an award based on that. Yeah, it was very
That
sweet.
is so cool.
Yeah. But what it did is when a woman has had a C-section and then she's able to have a vaginal delivery afterwards, it kind of is a reset so that she would be able, potentially, if she wanted more children, to continue to have vaginal deliveries. So she was just very excited, and she had a beautiful little girl, and they were just super grateful.
What is the biggest reward of your job? Either ICU or OB?
For me, I am filled by giving to others. I just have grown to love people in unique ways, and it's rewarding for me to give. That's the only way I can say it. I'm sure there's another way to say it, but I can't think of it right now.
Good for you. I mean, really, we need more people like you. With my experience with nurses at Northern Duchess, I just love them. Good. They really were amazing.
And there is always a concern. So there was a time when I was doing ICU nursing, and I found myself starting to have a wall, to a kind of like just going through the motions and not being moved with compassion as much.
A little jaded.
Yeah, exactly. Nurses can get bitter. Nurses can become resistive because you can get hurt over time, right?
Of course.
So I was realizing that I was heading in that direction, and that's also another reason why I switched over into OB.
Okay.
Because I felt like, you know what, I need to see something new, I need to experience something new, and that is the beauty of nursing. There's so many specialties, you can do anything. And if you're willing to learn something new, go for it.
And it's a profession, like we said before, there's so much shortage. For 20 years, I hear shortage of nurses.
Yeah.
So there's a job security right there.
Oh, yeah. There's not a place in the world that doesn't need a nurse. You can go anywhere in the world. I have friends who were from the Philippines who came to the United States because there was a shortage. And they had also worked over, I think it was Saudi Arabia. They had worked, in many different places. I've thought about, you can do Doctors Without Borders and go to different countries. And you can do community nursing in, hard to reach nations. There's just so many areas that you can apply nursing, and I'm staying local in my community because I feel this is where I'm supposed to be, but you can have an adventure with nursing for sure.
Absolutely. Wow, Jessica, thank you so much. That was so interesting and good to know about nurses for anybody that ends up in the hospital. Remember, your nurse is like your angel. They were for me, and they are angels. They really are. Thanks a million. That was so good.
Thank you.
Thank
you for giving me the opportunity to share.
Absolutely. Fantastic. Okay, that's a wrap for today. If you have a comment or question or would like us to cover a certain job, please let us know. Visit our website at howmuchcanimake.info. We would love to hear from you. And on your way out, don't forget to subscribe and share this episode with anyone who is curious about their next job. See you next time.